When I was preparing this presentation, a share by Allama Iqbal completely resonated with me and my journey of grit and kindness. तू समझता है राज है जिंदगी फकत ज़ौक़े परवाज़ है ज़िंदगी. Life is all about taking the courage to take a flight, especially when the ground feels unstable. Like it happened to me after A levels when I enrolled at Kinnaird College for politics but flunked and had to quit. So I gave MDCAT a try and landed at FMH College of Dentistry after a rigorous round of choices, interviews, merit lists, and rejections. Assalamu alaikum. My name is Dr. Fatima Rasool Ghuman. I'm currently one of the house surgeons at FMH College of Dentistry. Let me walk you through my journey where I learned that life is all about Zoke Parvaz. First year wasn't easy because we had online classes, COVID going on, new college, new people, strict teachers. It felt like an army school. A lot of new books, anatomy, physio, OB, whatnot, which literally just flew over my head. And I literally felt like drowning in this huge, big wave. So after 2 weeks of into it, I decided that I want to quit. The next thing I know, I'm standing outside the principal's office telling him that, I want to quit. I don't want to do this anymore. This is too overwhelming for me. And he listened to me very calmly and he offered me three very simple things: some tissue, a glass of water, and 30 minutes that changed my life. He told me, Fatima, why don't you just go to your class and observe everything? You don't have to learn, don't learn. Just go and observe, okay? Now that I'm thinking about it, it was literally a trap. I got trapped because after 2 weeks, this is a message I wrote him where I've written that I'm not a quitter and I will certainly not quit without a fight. This place, this beautiful college where during my first year I literally had to drag myself here, now I don't want to leave even when it's overtime. I'm just chatting with my friends, roaming around the corridor, but not going home because this place is now so special for me. This Phantom Head Lab is actually where the true transformation begins. During the second year, we started preclinical operative, where everything we learned in class about fillings, we actually had to do it. It was a safe environment where we had to practice, where we could make mistakes and learn before actually doing it on the real patients. Preclinical prosthodontics was another thing in which DM was integrated with prosthodontics. We learned about materials like alginate, and then we immediately had to deal with those materials as well. We also did crown fabrication second year. Due to a time crunch, I'm really rushing through the slides. Second year BDS, it was all about rigorous training in Phantom Head and realizing that you have to take one step at a time. But the actual small tiny win for me was when I got second position in class, which was like a really boost for me. And then I got two distinctions in my second year, one in community dentistry and another one in pathology. We also had multiple community visits, which actually bridged the gap between theory and the clinical part of dentistry. Research curriculum. This roadmap is something we religiously had to follow. Think of an idea, group of five, one supervisor, think of an idea, find literature gaps, write a synopsis, get it approved by IRB. Unfortunately for us, our research got wasted. But nevertheless, after reflecting upon it, because we already knew what to do, now during my house job, I've started to work on a new topic. My research topic is already in IRB for approval. Third year is a place where actually the clinical spark began. We had 1 week rigorous training, cross infection control workshop in each department. We had synchronized curriculum where we had 2 day alternating rotation where everything we learned in class, theory wise, was immediately translated into clinicals. I gave LA for the first time, which was like a real thrill. Rigorous training and simulation lab is a constant. Back then we used to think like, why are we doing this? Why I have to do these fillings again and again. But now we do realize, I mean, I do realize that we made mistakes in a safe environment, so we can confidently perform procedures on real patients. Loops were made mandatory, and BLS workshop is something that's routinely happening at FMH. Final year, personally, my favorite, powered by panic, certainly. Comprehensive patient care is something we had to do extensively, a good exercise indeed, because we had to plan a patient, starting from diagnosis, investigations, treatment planning, each and everything. We also had to present it in front of our faculty, colleagues, PGs, house officers, final year, and defend our case, defend our treatment planning. It's a really good exercise, I think. I was also the project director hepatitis BC. I'll quickly go over this. uh, Advanced cultural communication skill workshop, something we did really bridge the gap between um, the communication gap between patient and the dentist. Weekly CDs is something which is routinely happening at FMH. Our alumni from all around the world are coming home to give lectures talking about different pathways. Orodent care. I started going there after my third year. I still go there, but I started off as an observer, then an assistant, then a social media handler. But now finally, I get to do, sometimes I get to do fillings and scaling, and I've started to become a practitioner. It's a slow and steady journey. After my final year, I also went to Mayo Hospital for a 1 month 1 month internship before my house job. So during house job, I'll quickly again go over it. I was humbled 1 month in. I was humbled to host a panel discussion. CPC is something we had to do again, but this time it was not limited to planning. We also had to execute this, and we also had to present it and defend it. Poster competitions, um, pre and post conference workshops. It was the first time we conducted new FMS International Conference, Crown and Bridge workshop, portfolio workshops. Exit exam is something we also have to give at the end of our house job, which includes theory portion as well as OSCE stations. Talking about portfolio workshop, it was a really good workshop. I made my own portfolio after that, which is a really cool way to document whatever you're doing. And we actually we can always go back to our cases, learn from it, and also present it. This is something, this is one example of how I document my case. In the end, I just want to add that it's not the end, it's just a beginning, because fakat zauke parvaz hai zindagi. Thank you so much for your time. It's 8 minutes. I'm really sorry for taking 2 minutes above, and really hope to see all of you in Karachi soon. Thank you so much. Allah Hafiz.